this trial focuses on elderly patients who are over the age of 55 who have either refractory or relapsed acute myelogenous leukemia that is not responding to standard therapy. It's actually a double whammy. So if you have patients who have active disease at the time of transplant, they do not do well. And elderly with acute myeloid leukemia generally do not do well. So when the patients do need to be in remission when they go into transplant, because the transplant outcomes are better if the patients are in remission at the time of transplant. But because this group of patients, this trial is directed towards patients who are not going into remission, and so that's really the worst of the population that we can have, both elderly patients and patients that are not responding to treatment. So the way the trial was designed is that you need to have a refractory disease in an elderly patient population, and the patients were going to be randomized to either the Sierra arm, which is the active treatment arm, where they will be given this CD45 directed antibody called Iomab-B, and there is a conventional arm where they will receive the conventional treatment. So if in the conventional group, if the patients do not go into remission and still have a good performance status, they can be transferred over to the Sierra arm. So approximately 150 patients are going to be randomized with approximately 75 patients in each arm, and the primary endpoint of the study is complete remission and survival at 6 months post-transplant.